only successful because of the staff, the hard work that they did. And they took it upon themselves to make sure that everyone was taken care of.
We knew that COVID was coming, and the Iowa Tribe leadership was very proactive and brought in directors from programs, the health department, the child care center, the elders program, so that we could all work together to be prepared to take care of tribal members, our employees, and the community.
You know, everything was going to be shut down. And the week that happened, we had a meeting. It was a Monday, March 9th. And then in a few weeks, you know, everything shut down. And there was a lot of unknown during that time. There was a lot of anxiety. People were really unsure of how to treat patients. We didn't know, you know, how fast it spread.
We didn't have our tribal powwows. We didn't have any gatherings. Everything was shut down. So not only were we culturally shut down, but we were shut down to our families also.
Fortunately, in December of 2020, we were able to get some of the initial vaccine that came out. We immediately gave it out to our staff. And state public health agencies weren't getting the vaccine through their channels. So everyone was coming to the tribes to get vaccinated.
And when I pulled up there, you know, it kind of looked like a war zone because there's people everywhere, and that really impacted me because this was an epidemic, and it's hitting home. It's hitting my tribe, my community, friends, and family, and some people weren't taking it serious, and and I think that's why it did continue to spread so fast.
Our dental department was not able to provide dental services during that time because of transmission, and so we cross-trained individuals in dental and in our behavioral health department to help with COVID testing and vaccine administration. We partnered with community partners, state level, federal level, to do mass vaccination events and testing events. We were doing hundreds of tests a day to make sure that people were kept safe in the community. We had people drive from Colorado, Texas to come get tested at our site because testing wasn't available everywhere.
Dr. Williams, she contacted COVID like 6 times, but she was still doing that. She was still testing for the community, still trying to take care of our patients. And a lot of them weren't her patients. She's a dentist.
You know, God bless the health workers. They were right there, ground zero, and a lot of them, it was tough on them. You know, it's seeing people die and trying their best to save lives. It was hard mentally. It's a mental stress.
We have a small but mighty mentality because we take pride in serving all of those individuals. One of the things that I love about us is you'll see our leadership on the front lines, providing vaccine and meeting patients where they are, and that makes us different. We have different experiences because we are seeing everything happen right in front of us, not in our offices.
And so the resiliency of our ancestors, that was during their time. And so we're facing the same thing during our time. Our resilience, the things that we've learned will support future generations.